Good morning. Imagine waking up and as soon as you get up, the world starts to spin wildly. Nausea overwhelms you and you can't stand up. This is the reality of millions of people who suffer from dizziness, a symptom that can radically change the quality of life. But what are dizziness really? It's not just movement, it's a warning bell from the body that signals an imbalance. Today we will explore this symptom from two perspectives: the accuracy of Western medicine and the holistic view of Chinese medicine. By combining these two medicines, we can offer patients a more comprehensive treatment. We will find out how, but first, a quick test. How many types of dizziness do you know? A. Sensation of spinning. B. Instability without movement. Or C. Imminent fainting. If you answered A, you are correct. True vertigo involves a false perception of movement. Let's begin our journey. Let's enter the first part of our in-depth analysis, examining vertigo according to the criteria of contemporary Western medicine. What distinguishes vertigo from a simple imbalance? The answer is simple, but often misunderstood by the patient. Dizziness is an illusory movement. Imbalance is instability without the perception of rotation. Lightheadedness is imminent fainting. Always ask, is it a spinning sensation? Is there nausea? Do you see things moving? This immediately guides the diagnosis. Dizziness is divided into three main categories: peripheral, central, and non-vestibular. Let's look at them together with practical examples. Peripheral vertigo accounts for 80% of cases. The most common is benign paroxysmal positional vertigo. Small calcium crystals detach. The diagnosis is made with the Dix-Hallpike maneuver and the therapy with the Epley maneuver. Vestibular neuritis is an inflammation of the nerve, often viral. It causes intense dizziness for days, nausea, and spontaneous nystagmus. Ménière's disease is characterized by the classic triad: episodic vertigo, fluctuating hearing loss, and tinnitus, or ringing in the ears. If a patient experiences dizziness when turning in bed or bending down, think immediately of benign paroxysmal positional vertigo. It often resolves with a simple maneuver. Central vertigo is rarer, about 20%, but more severe because it stems from problems in the central nervous system. A stroke of the brainstem or cerebellum is an emergency. If there is double vision or difficulty speaking, an immediate MRI is needed. Multiple sclerosis and vestibular migraine, triggered by visual or food-related triggers, also fall into this category. There are also non-vestibular vertigo, which do not directly involve the ear or the brain, such as orthostatic hypotension. Common causes include anemia, which reduces brain oxygenation, hyperventilation, or the use of diuretics and antidepressants. Quick test. If a patient experiences dizziness when getting out of bed in the morning, what would you suspect? The answer is orthostatic hypotension. Now let's look at a key table for differential diagnosis. In peripheral cases, the duration is seconds or minutes with horizontal nystagmus. In the centers, vertigo is subjective, lasts for hours, and the nystagmus is often vertical and not suppressible. Nausea is less frequent. In non-vestibular cases, imbalance prevails, often accompanied by sweating and pallor. Copy this table, it is very useful. Imagine a patient with dizziness for 2 days and horizontal nystagmus. You would suspect vestibular neuritis. Clear, right? The diagnosis requires a structured approach. We start with a detailed history regarding the duration and triggering factors. Vestibular tests follow, such as the Romberg test and the assessment of cranial nerves for neurological coordination. Instrumental examinations are fundamental: magnetic resonance to exclude tumors, audiometry for Ménière's disease, and video nystagmography. Let's enter the pathophysiology. Why do the ear or the brainstem cause dizziness? It all starts from the semicircular canals. When the channels send incorrect or asymmetric signals, the brain receives contradictory information and perceives a non-existent movement. In the centers, a stroke in the brainstem interrupts the connections with the cerebellum, causing dizziness and neurological deficits. If a patient has dizziness, double vision, and weakness in one arm, the lesion is almost certainly in the brainstem. Now that we have seen Western medicine, let's move on to Chinese medicine, where dizziness is an energy imbalance. In Chinese medicine, dizziness is not just an organ problem, but a disruption of the harmony between qi, blood, and the viscera. We see the head as an area that must be nourished by the pure qi that rises, by the blood shui, and by the essence Jing of the kidneys. The main causes include excess yang of the liver due to stress, spleen deficiency with phlegm, or aging of the kidneys. If the patient worsens with stress and is irritable, we immediately suspect an ascension of liver yang. Let's look at the patterns. The first pattern is the ascension of yang of the lever, dizziness with frontal headache, red face, irritability, and insomnia. The wrist is corded. The therapy uses acupuncture on points such as gallbladder 20 and liver 3, in addition to phytotherapy and a non-spicy diet. The second pattern is spleen qi deficiency with phlegm, dizziness with a feeling of heaviness in the head and nausea. The tongue is swollen and greasy. Let's tone it with stomach point 36 and a diet based on hot soups, rice, and pumpkin. The third pattern concerns the deficit of René and Jing, typical of aging, chronic dizziness, tinnitus, and poor memory. The treatment acts on points kidney 3 and bladder 23, with the addition of walnuts, sesame seeds, and nutrient-rich foods for the Jing. Quarter pattern, blood stagnation, dizziness with fixed pain in the head and purplish lips. We use points like liver 3. Finally, the yin deficiency of heart and kidney, nighttime dizziness, palpitations, and sweating. Key points, heart 7 and kidney 3. In Chinese medicine, the diagnosis is based on the interview and careful observation of the color of the face, the tongue, and the pulse. Example, if you see a swollen tongue with a greasy coating and a slippery pulse, you will know it is spleen deficiency and phlegm. The therapies of Chinese medicine are not alternatives to Western medicine but can complement it to improve outcomes. Key points such as gallbladder 20 eliminate wind, governing vessel 20 lifts pure yang, and stomach 36 tonifies the stomach and spleen. Phytotherapy and diet are pillars. We avoid spicy foods for the liver and dairy products to not overload the spleen. The movement through Tai Chi or Qigong improves the circulation of Qi in blood, significantly reducing dizziness. Now that we know both medicines, let's discover how to integrate them to provide the patient with truly comprehensive care. Integration is the future. Let's compare the strengths of these two millennia-old and scientific approaches. Western medicine is analytical, based on organic causes. Chinese medicine is holistic, based on global energy imbalances. One uses magnetic resonance and audiometry, the other language and pulse. By integrating them, for example, in benign paroxysmal positional vertigo, we combine epley and acupuncture on gallbladder 20. In vestibular migraine, we can use Western medications for frequency and Chinese acupuncture to manage related stress. In Ménière's disease, the Western low-sodium diet is combined with Chinese herbal therapy to drain excess phlegm heat. Now it's your turn. Let's put into practice what we've learned with 3 real clinical cases from my professional practice. Case 1. 68-year-old patient, brief dizziness when turning in bed, mild nausea. What is the integrated diagnosis? Occidental benign paroxysmal positional vertigo, Chinese qi and blood imbalance we resolve with epley maneuver and acupuncture on gallbladder 20. Case 2, 70 years old, chronic dizziness, tinnitus, and lower back pain, pale tongue and deep pulse. What pattern do you see? It is a kidney and Jing deficit. We integrate magnetic resonance for safety with tonification of Jing through acupuncture and targeted diet. Case 3, 55 years old, dizziness when getting out of bed. History of hypertension and use of diuretics. What is the cause? Orthostatic hypotension from medications and spleen deficiency. We reduce diuretics and tone with point stomach 36. We are in the final stages. Let's reflect together on the importance of this collaboration between science and tradition. Is Chinese medicine useful for everyone? Yes, for chronic or resistant cases, but emergencies like strokes remain in the hospital's domain. The limits are the need for more scientific evidence and accessibility. Multidisciplinary collaboration is the key to improvement. Let's summarize. Not all dizziness is the same, and the Western diagnosis is essential to rule out serious conditions. Chinese medicine offers a valuable holistic perspective, and the integration between the two worlds is possible and desirable. As Lao Tzu said, health is the result of the balance between yin and yang, a principle that perfectly applies to dizziness. If you liked the video, give it a thumbs up, subscribe, and activate the bell. Write your questions in the comments. For further insights into my study in Lugano, here are my contacts. I hope this trip has been useful to you. Remember, health is balance, and you are the tightrope walkers of your destiny. Good health to everyone.